According to a consensus statement by the International Society on Hypertension in Blacks, high blood pressure in African Americans is such a serious health problem that treatment should start sooner than it usually does, and it should be more aggressive than it often is. Joining us to discuss the matter is Dr. David Krause, a cardiologist from the Memphis Heart Clinic. And welcome to Smart Medicine's Heart of the Matter, Dr. Krause.
Well, thank you, Joe, and I appreciate the Baptist Hospital asking me to be here.
Hypertension is a major issue, high blood pressure, right?
Well, the two largest risk factors for cardiovascular disease and development of heart failure are coronary disease and high blood pressure or hypertension. It's rampant in our community, and particularly I would say that Memphis is one of the largest communities in the whole United States for the development of heart failure. And in essence, hypertension is the key issue here.
How does it affect your body?
Well, high blood pressure, in essence, does a lot of bad things to your body. It takes a while. It's a silent illness for many years. In essence, it can cause kidney disease, heart disease, ophthalmologic or eye problems, and certainly is a key factor in causing stroke and brain disease.
How do you identify high blood pressure?
Well, some people actually come in symptomatic with dizziness or fatigue. They might have some chest pain. They might feel short of breath. But symptoms vary from patient to patient. Many patients go for years without any symptoms. Oftentimes, patients go to a health fair and they're found to be hypertensive. They might go to donate blood, and they're found to have to be hypertensive. They might go to the dentist and have their blood pressure checked. They might go to Walgreens or a drugstore somewhere in Memphis, or just a Kroger to go shopping and get their blood pressure checked. There's a lot of ways to identify high blood pressure.
Well, we know this new information is out there about African Americans specifically. How does this compare to what we knew about hypertension in African Americans before and what we've learned now?
Well, the basic tenet that we've all known is that high blood pressure was originally thought to be a blood pressure that was above 140 over 90 millimeters of mercury. That's the standard JNC7 guideline, which was the most updated guidelines back in the early decade, this past decade, that were handed down for people to begin therapy of some form. A normal blood pressure would be a blood pressure of 120 over 80 under those guidelines, and anywhere from 120 over 80 to 140, or I should say 139 over 89 would be considered pre-hypertension. The guidelines that came out from the international consensus on hypertension in blacks actually lowered those numbers, and it came out of some information that was quite interesting, and that in young African American students or black students around the world, they found that the central aortic pressure, which is a pressure that the heart, the kidneys, and the brain sees, actually turned out to be a bit higher than their cohort and that were Caucasian or non-black individuals. And this pressure is actually the bad pressure. It's the one that we really need to be measuring. They also found that the arterial stiffness was a little bit higher. There are ways of measuring that in certain settings. And finally, they found that doing an ultrasound on a carotid artery, which is the artery in your neck, and imaging that artery, the thickening of the intima or the inner lining of the artery, the blood flows across that layer of the artery, actually is a bit thicker in these young individuals. And for this reason, they felt that identifying young black individuals in particular, would be of great importance to identify patients at higher risk. And they also noted, and this has been well known, that in fact, if you look at blood pressure risk as it relates to cardiovascular event rates, the event rate doubles for every 20 millimeters of mercury that your blood pressure goes above 120. So they actually lowered the start therapy level to 115 over 75 in African Americans because of their increased risk as such, and that's where these numbers came from.
And this new study gives you the advantage of knowing that work should begin much earlier in young people's lives to identify these individuals so that treatment can begin earlier.
Absolutely. And the earlier the better. And the reason this is that it takes years to develop end-stage kidney disease and end-stage heart disease. The earlier we get to patients, the more likely we are to prevent disease, which is what we call end organ disease in the practice of medicine. Obviously, stroke can occur acutely if a patient's blood pressure rises acutely, but it also occurs as a long-term process from long-term cardiovascular illness that occurs with thickening of the lining of the arteries. As I mentioned, in the carotid artery, you can develop gradual thickening. This occurs up in the cerebrovascular tree, which is the vessels that supply the blood to the brain.
Well, this is an issue all of us should be concerned about, no question. So what are some of the things we should be doing to have a heart-healthy lifestyle and prevent hypertension?
The first thing you need to do is cut salt out of your diet. Here in the South, we love barbecue, we love our food, we love to eat. We absolutely eat too much salt. In our practice, we start, the cornerstone of our therapy is a DASH diet. And the DASH diet is an acronym for Dietary Alternatives to Stop Hypertension. And sitting next to me at my desk in my office is a folder full of DASH diets. We give them out to every single hypertensive patient that walks in the office. It's rare to see somebody come in that eats a 2 to 3 gram salt diet. You should minimize alcohol consumption. You should at least exercise 3 or 4 days a week, at least 30 minutes. And then obviously obesity is a big issue. Tobacco is an absolute abstinence scenario if you have hypertension. You can go on and on and on about cardiovascular risk factors. We call these things somewhat, the first scenarios, lifestyle modifications. The second scenarios are modifiable risk factors that we have in our practice, and they're all medically manageable scenarios.
Well, Dr. David Kraus, thank you so much for joining us here on Heart of the Matter, here on Smart Medicine. To learn more about this hypertension study, you can go to WKNO.org and click on the Smart Medicine icon, or go to smartmedicine.tv.